Celebrity chef Paula Deen, the queen of Southern cooking, is stirring up quite a controversy. She announced yesterday she has type 2 diabetes and is making no apologies. Deen learned 3 years ago she had the disease but did not tell anyone. She says she'll keep cooking her deep-fried comfort food and will now promote a diabetes drug. So here to discuss this is Dr. Loren Greene, an ethicist and clinical associate professor of medicine at New York University's Langone Medical Center. Thanks for being with us.
Thank you for having me here.
So type 2 diabetes is a very common form of diabetes. Somewhat 23 million Americans have it. So tell us exactly, how do you get it and what kind of symptoms do you experience with it?
First of all, it's a very common disease, as you said, and people get it just by getting older, and their pancreases are wearing out as they age, but also young people are getting it now because of obesity primarily and lack of exercise. So it's become an epidemic in American life and in many Western countries as well.
So if you have it, or maybe don't even know that you have it, what are the symptoms that you'll experience?
Sometimes you have it for many years before you have any symptoms. It's not until your blood sugar gets to a certain level that you begin having real symptoms, and that could be being very thirsty because your blood sugar is going up, urinating very frequently, drinking more liquids, which makes you urinate even more frequently because you're so thirsty, and then urinate out a lot of the liquids along with the sugar in your bloodstream going into making more urine. You have fatigue. You could just be much more tired than you had been before as your blood sugar gradually rises. But the problem with it is it's usually insidious. It happens over years. You don't usually have a sign on your head saying, "Hi, I have a high blood sugar," and sometimes it's first recognized with a laboratory test.
So when it comes to food, Paula Deen is known for, these high caloric fatty foods. I mean, we know about fried macaroni and cheese and all this good stuff that tastes terrific going down, but sometimes is not the best for you. Is that something that can attribute to a disease like this? Could it be the blame?
I certainly think it is the blame if you're going to continue eating it. I mean, she might have been predisposed to getting diabetes anyway. I don't know if other people in her family have diabetes or if there was any warning that she had particular risk, but certainly continuing to consume excess calories, excess carbohydrates, excess fatty foods can certainly lead to diabetes.
Well, she says she does it in moderation. Can you manage this particular type of diabetes?
I can't imagine fried macaroni and cheese in moderation. I mean, is it one bite?
I don't think I can stop at one bite.
It's supposed to be 5 different cheeses fried in this concoction, and if you don't get reflux from it, well, I guess you can certainly over the years get diabetes from it.
As an ethicist, let me ask you this question. She says that she's known about this for 3 years, but she's just come out now. At the same time, she's also promoting a diabetes drug. Is there something wrong in the parallels and the timing of this in your eyes?
Well, first of all, she was always entitled to her personal privacy. She could have it for right now and not say anything about it if that's what she wanted to do. But if she's going to be promoting something healthy, if she's going to be promoting taking better care of your diabetes, then she's really doing 2 opposite things at once. And what worries me is that she's telling other people that they can have good care for their diabetes while they continue to eat this way, and at the same time she's promoting a drug, which means that the advertisement for the drug is getting confused and conflicted with her show, which is supposed to be about diet and I suppose about health. And there's no way you can be healthy and eat these foods, and it's wrong to assume that a drug is the first fix. The first fix is really diet and exercise, a better, healthier lifestyle, and eating the right foods when you're eating foods. So I think it's wrong for her to conflate or combine both an advertisement for a drug, and the drug does help you lose weight in the sense that it might make you feel full sooner, and it does contribute to helping people with diabetes, but the drug should be an add-on. First comes diet and then exercise and healthy lifestyles as much as possible, smaller portions, watch what you eat, and then add the drug when you need it.
All of that is very important. Dr. Greene, we do appreciate your insight. Thank you so much for joining us.
Thank you very much for having me here today.